Adaptation of the Family Guide to the Rancho Levels of Cognitive Functioning. Hello, my name is Alena Seresova, and I'm a medical speech-language pathologist at the McGill University Health Center. The following document was adapted from the Rancho Los Amigos National Rehabilitation Center original document. Cognition refers to a person's thinking and memory skills. Cognitive skills include paying attention, being aware of one's surroundings, organizing, planning, following through on decisions, solving problems, judgment, reasoning, and awareness of problems. Memory skills include the ability to remember things before and after the brain injury. Because of the damage caused by the brain injury, some or all of these skills will be changed. The Rancho Levels of Cognitive Functioning is an evaluation tool used by the rehabilitation team. The 8 levels describe patterns or stages of recovery typically seen after a brain injury. Each person will progress at their own rate, depending on the severity of the brain damage, the location of the injury in the brain, and length of time since the brain injury. Some individuals will pass through each of the 8 levels, while others may progress to a certain level and not advance in the next higher level. It is important to remember that each person is an individual and that there are many factors to consider when assigning a level of cognition. There are a range of abilities within each of the levels, and your family member may exhibit only some or all of the behaviors mentioned later. At the MUHC Montreal General Hospital Trauma Center, a dedicated team of professionals with an expertise in the management of patients with traumatic brain injury will be involved at appropriate times during the continuum of the patient's stay. The members of the TBI team include, but are not limited to, doctors and nurses, speech-language pathologists, social workers, neuropsychologists, occupational therapists, registered dietitians, and physiotherapists. The Rancho Levels of Cognitive Functioning. Cognitive Level 1. No response. At this level, the patient will not respond to sounds, sights, touch, or movement. The patient is usually in the ICU, and an ICU journal may be started. Cognitive Level 2. Generalized response. At this level, the person may begin to respond to sounds, sights, touch, or movement. These responses may include chewing, sweating, breathing faster, moaning, moving, increasing heart rate or blood pressure. They may respond slowly, inconsistently, or after a delay. They may respond in the same way regardless of what they hear, see, or feel. Cognitive Level 3. Localized response. At this level, the patient may be awake on and off during the day, react more specifically to what he hears or feels. They may turn their head towards a sound, withdraw from pain, follow a person around the room with their eyes. They may react slowly and inconsistently. They may begin to recognize family and friends. They may follow some simple commands, such as, look at me, squeeze my hand, show me 2 fingers. They may begin to respond to simple questions with yes and no head nods. What can the family and friends do at levels 1, 2, and 3? Explain what you are about to do. For example, I am going to move your leg. Talk in a normal tone of voice. Keep comments and questions short and simple. Instead of saying, can you turn your head towards me? Say, look at me. Tell the person who you are, where they are, why they are in a hospital, and what day it is. Limit the number of visitors to 1 to 2 people and keep the visits short. Keep the room calm and quiet. Bring in a few pictures of family members, friends, and preferably arrange them in an album so that not to visually clutter the space around your loved one. Allow the person extra time to respond, but don't expect responses to be correct. Sometimes they will not respond at all. Allow rest periods. They will tire easily. Engage them in brief, familiar activities, such as listening to favorite music, talking about family, reading out loud, watching TV, combing hair, or putting on lotion. They may understand parts of what you are saying, therefore be careful what you say in front of them. Cognitive level 4, confused and agitated. At this level, the person may be very confused and frightened. They may not understand what they feel or what is happening around them. They may overreact by hitting, screaming, using vulgar language or thrashing about. This is because of the confusion, and they may require restraints for their own safety. They may be highly focused on basic needs, such as eating, going to the washroom, or going home. Language deficits may become more apparent at this level. The person may not pay attention or be able to concentrate for more than a few seconds. They may have difficulty following directions. They may recognize family and friends. With help, they may be able to do simple routine activities such as feeding themselves, dressing, or talking. The North Star Orientation Board may be introduced by one of the members of the traumatic brain injury team. What can the family and friends do at level 4? Tell the person where he is, the date, and reassure them that they are safe. You can use the North Star board or a calendar. Bring in family pictures in an album. Let the patient leaf through them. Show patient short family videos, or make brief video calls. Experiment to find familiar activities that are calming, but for a few minutes only, as not to overstimulate. Keep the room quiet and calm. Turn off the TV, the radio, don't talk too much, use calm voice. Do not force the person to do things, rather, listen to what he wants and follow his lead within safety limits. Give him breaks and change activities frequently, as he can become distracted, restless, or agitated. Allow him as much movement as is safe. Verify with nursing or physiotherapist. Cognitive level 5, confused and inappropriate. At this level, the person may be able to pay attention for only a few minutes. They may not know the date, where they are, or why they are in the hospital. They may not be able to start or complete everyday activities, may need step-by-step instructions and assistance. They may become overloaded with information and restless when tired or when too many people are present. They will remember events from the past, from before the accidents, better than their daily routine or information that has been told to them since the injury. They may try to fill in gaps in memory by making things up. We call this confabulation. They may get stuck on an idea, overly focus on basic needs, such as going home, going back to bed, going to the bathroom. We call this perseveration. What can the family and friends do at level 5? Repeat things as needed. Use the North Star board or a calendar. Tell them the date, name, and location of the hospital. Tell them why they are in the hospital when you first arrive and before you leave. Don't ask questions about it, but announce it. Bring in family pictures and personal items, but don't clutter the room and walls. Give them frequent rest periods when they have problems paying attention. Limit the number of visitors to 2 at a time, maximum. Cognitive level 6, confused and appropriate. At this level, the person may be somewhat confused because of memory and thinking problems. They may remember main points from conversation, but forget and or confuse the details. They may remember that they had visitors, but forget when they came or what they talked about. They may follow a schedule with some assistance, but become confused by changes in their routine. They may know the month and the year unless there is a severe memory problem. They may be able to pay attention for about 30 minutes, but they may have trouble concentrating when it's noisy or when an activity has many steps. They could brush their teeth, get dressed, feed themselves with some help. They may do or say things too fast without thinking first. They may know when they need to use the bathroom, know why they are hospitalized, but not understand all of the problems they are having. They will usually be more aware of physical problems rather than thinking problems. They will associate their problems with being in the hospital and think that they will be fine as soon as they go home. What can family and friends do at level 6? You will need to repeat things. You may start a daily written log. Have the patient write the date, time, visitor name, including the names of the therapists and doctors. They may write what was done during each therapy session. They may need help starting and continuing activities. Encourage them to participate in all therapies, as they may not fully understand the extent of their problems and the benefits of therapy. Discuss things that have happened during the day to help them improve their memory. Cognitive level 7, automatic and appropriate. At this level, the person may be able to follow a set schedule. They can dress or feed themselves independently, but may have problems in new situations and may become frustrated or act without thinking first. They may be able to do routine self-care without help, if physically able. They may have problems planning, starting, and following through with activities. They may have trouble paying attention in distracting or stressful situations, during family gatherings, at work, at school, in a church, or during sport events, or even just with a group of people. They may not realize how their thinking and memory problems may affect future plans and goals. Therefore, they may expect to return to their previous lifestyle or work without any adaptations, just like before. They will continue to need supervision because of decreased safety awareness and judgment. They may think slower in stressful situations. They may be inflexible or rigid and may seem stubborn. They may be able to talk about doing something, but will have problems actually doing it. Cognitive level 8, purposeful and appropriate. At this level, the person may realize that he has a problem in his thinking and memory. He may begin to compensate for his problems. He may be more flexible and less rigid in his thinking. He may come up with several solutions to a problem instead of perseverating with one. They may be able to learn new things, but at a slower rate. They may still become overloaded with difficult, stressful, or emergency situations. They may show poor judgment in new situations. They may have thinking problems that may not be noticeable to people who did not know them prior to the injury. They may be ready for driving or job training evaluation. What can family and friends do at levels 7 and 8? Talk with the individual as an adult. No need to use simple words or sentences. Be careful when joking or using slang, because the meaning can still be misunderstood. Also, be careful about teasing them. Help them in familiar activities so that they can see some of the problems they have in thinking, problem solving, and memory. Talk to them about these problems without criticizing. Reassure them that the problems are because of the brain injury. Strongly encourage the individual to continue with therapy to increase his thinking, memory, and physical abilities. He may feel he's completely normal. However, he's still making progress and may possibly benefit from continued treatment. Encourage him to take notes as a way to help him with remaining memory problems. Be sure to check with the physician or the team with regards to restrictions concerning driving, working, and other activities. Do not rely on the patient for information. Encourage him to carry out his self-care as independently as possible. Discourage him from drinking or using drugs. due to medical complications. Discuss what kinds of situations make him angry and what he can do in these situations. Talk with him about his feelings. Learning to live with a brain injury can be difficult, and it may take a long time for the individual and family to adjust. The social worker and/or psychologist can provide the family and friends with information regarding counseling, resources, and/or support organizations. The information presented in this document is for specific health education purposes only. Persons should consult qualified healthcare professionals regarding specific medical concerns or treatment. Each clinician caring for the patient is responsible for determining the most appropriate care. Thank you.